Hi Rob, could you introduce yourself please?
Hi, yes, I'm Rob Howard. I work for Medway Community Healthcare. My role, my day job, if you like, is as Associate Director Business Intelligence. But my involvement in this project has been a bit of a combination, covering the data side of things, so the evidence about nurses working in a different way, reviewing IT systems and how they can help the nurses, and a bit of project support where I can in terms of planning our mobilisation across our organisation.
Thank you. And the project we're talking about, and that's why we're sitting here in the beautiful French city of Lille, and the project we're talking about is the Transforming Integrated Care in the Community project. From your point of view, with your role that you've just described, Rob, what's been the best thing about this project?
I really latched on right from the start, excited about the self-managing principle in the NHS across England. Often come into contact with nurses that are talking about themselves in hierarchies, that I'm only a band 5, I'm only a band 6, and feeling that they don't have control or don't even expect to have control about decisions about the way they run their service. So seeing that this would mean every member of a team is an equal and has a joint say in how they run and deliver care is what was motivated me from the beginning.
Thank you. And what's been the biggest challenge? And of course, this is a 4-year project, and right in the middle of that's been 2 years of COVID. So that's obviously been a big challenge, and maybe that's been the biggest one. But from your point of view, what has been the biggest challenge that you've faced?
Yeah, so for my role, taking a bit of kind of ownership about the data we've got to evidence the change in practice. It's been frustrating that we haven't got harder evidence than we have to date, and that has been thwarted by COVID, obviously, but also our organisation changed IT systems. So we're still on quite a journey to evidence that we are having better outcomes and changes in caseload sizes, that side of thing. We're getting there, but I would like us to have had something more solid at this stage in the journey.
Thank you. And last question, we've talked a lot over the period of the project about the importance of an organisation's back office supporting the frontline nursing staff effectively in their self-management and in their clinical roles. Thinking about that, is there anything with the benefit of hindsight that you think others could learn from the Medway experience, the positives and the negatives of it?
Yeah, I think for our organisation, but I'm hearing similar for some of the other partners, everyone recognised the importance of the back office, but actually owning it and making that change embedded within the organisation has been left quite late on. And so I would, if we were to do it again, I would really stress the importance of grasping that right at the beginning. Still hearing from my colleagues that still quite a lot of bureaucracy and steps to enable them to procure easily, to relocate, that sort of thing on the IT side of things as well. So we've made adaptations to our community nursing staff, but maybe not made them business as usual yet. So the nurses still aren't seeing the benefit of that. And ultimately, this is all about releasing time to care. So there's still an awful time that we can release for those nurses to spend with patients.
So it's still a work in progress, really.
Yes, yeah.
Thanks, Rob.
Okay, thank you.
Cheers.
Bye-bye.